What if the food you consume daily is a potential health risk? It's a question that has recently taken on new urgency with the outbreak of bird flu, a disease that has already had significant implications for our food industry and potentially our health. In the heart of Texas, the largest egg producer in the United States, Cal-Maine Foods, has been forced to temporarily halt operations due to an outbreak of bird flu in their chickens. The scale of this outbreak is vast, with more than 1.6 million hens and 337,000 pullets culled in an attempt to control the spread of the disease. And it's not just chickens that are affected. The virus has been detected in a variety of livestock across several states, including goats, dairy cows, and cattle. This has led to the second confirmed human case of avian influenza in the U.S., diagnosed in a Texas dairy worker. Despite the alarming headlines, it's important to remember that according to the Centers for Disease Control and Prevention, the risk to human health remains low. However, they do advise caution. It's crucial to avoid close contact with infected animals and to be mindful when handling raw food products. So, what does this mean for us and our daily lives? How will the bird flu outbreak impact the poultry industry and our economy? What are the health risks and symptoms we should be aware of? And what can we do to protect ourselves and our loved ones? We'll be addressing all these questions and more in the following segments. While the CDC emphasizes low human health risk, they advise caution around infected animals and raw food products. The poultry industry is feeling the impact of the bird flu outbreak. This wave of avian influenza has left its mark on our feathered friends, affecting chickens, goats, dairy cows, and cattle in several states. The reach of this virus is indeed widespread, leaving no corner of the livestock industry untouched. The impact on the poultry sector is significant. For instance, Cal-Maine Foods, the largest egg producer in the United States, had to temporarily halt operations at a Texas facility due to the bird flu outbreak in chickens. This has resulted in the culling of millions of hens and hundreds of thousands of pullets. The sudden reduction in the poultry population has serious implications for the supply and demand balance, which is bound to affect both egg and chicken prices. The effects of this outbreak are not limited to the price tags in our grocery stores. The poultry industry is a significant contributor to the country's economy, and a disruption of this magnitude can have far-reaching implications. For example, the halt in operations at the Texas facility of Cal-Maine Foods is not just a setback for the company, but also for the local economy. Jobs are at stake, and the economic ripples can be felt across the supply chain, from feed suppliers to transportation companies. The outbreak could also impact other sectors of the economy. For instance, the rise in egg prices could affect the baking and confectionery industry, which relies heavily on eggs. Similarly, the restaurant industry, particularly fast food chains that offer chicken-based products, could see a rise in costs. Furthermore, the dairy industry is also under threat, with the virus detected in dairy cows. This could potentially lead to a decrease in milk production and a subsequent increase in dairy prices. In a broader sense, the stock market could also feel the effects. Companies related to the poultry and dairy industries may see their share prices affected as investors react to the potential risks and uncertainties. The ripple effects of the bird flu outbreak are far-reaching, impacting not only the poultry industry but potentially our daily lives. What are the potential health risks and symptoms of bird flu in humans? That's a question that's on many minds right now. To answer this, let's delve into the details. Bird flu, or avian influenza, is a viral infection that primarily affects birds but can, on rare occasions, infect humans. The symptoms in humans are similar to those of other respiratory diseases. The most common symptoms include fever, coughing, and muscle aches. These symptoms might be accompanied by a sore throat, runny nose, or even difficulty breathing in more severe cases. Now, we've seen recent news about a dairy worker in Texas being diagnosed with bird flu. This marked the second human case in the United States. Despite this, it's crucial to remember that the risk to the general public is considered low. This is because bird flu doesn't easily transmit from person to person. However, low risk does not mean no risk. We can't afford to be complacent. In April 2023, the Centers for Disease Control and Prevention, or CDC, confirmed a rare case of avian influenza in the U.S. The infected person had contact with cows presumed to have bird flu. This individual is currently recovering after receiving flu antivirals, which are medications used to prevent or treat flu viruses. The CDC has advised the public to monitor for symptoms and avoid contact with sick animals. Food safety measures are in place, and the severity of the disease can vary from mild to severe, and in rare instances, it can be fatal. Remember, it is essential to seek medical attention if you experience any of these symptoms and you believe you may have been in contact with an infected animal. Awareness and swift action are vital in preventing the spread of this disease. In a nutshell, while bird flu in humans is rare and the risk to the general public is deemed low, it's important to stay informed about the symptoms and to take necessary precautions. Awareness is the first step in prevention. Stay informed and stay safe. What can we do to prevent further spread, and what are the future implications of this outbreak? Taking a step forward, the Centers for Disease Control and Prevention, or the CDC, strongly advises us to monitor for symptoms and avoid contact with sick animals. This includes livestock like chickens and cows, which have been recently affected by the bird flu. The symptoms for humans, such as fever, coughing, and muscle aches, may seem common but should not be taken lightly. If you or anyone you know starts experiencing these symptoms, seeking immediate medical attention is crucial. Now, you might be thinking about food safety. Rest assured, there are stringent measures in place to ensure the safety of food products. This includes the careful monitoring and culling of infected animals, as well as stringent checks on farms and facilities. But what about the future? What are the implications of this outbreak on our economy and our health? The poultry industry is likely to see a significant impact. The recent halt in operations at a Texas facility run by Cal-Maine Foods, the largest egg producer in the United States, is just the tip of the iceberg. This could potentially lead to an increase in egg prices affecting everyday consumers and businesses alike. The impact on the stock market could be substantial, with companies related to the poultry industry likely to see a decline in share prices. And let's not forget about the impact on our health, especially for various age groups and individuals on specific diets. Children, due to their developing immune systems, could be more susceptible to the bird flu. Moreover, individuals on the keto diet who consume a high amount of poultry products need to be particularly careful about the source of their food. As we navigate this outbreak, it's crucial to stay informed, take preventive measures, and consider the potential long-term effects on our health and economy.